This award really represents a full circle moment in my journey with clinical reasoning that started when I was a medical student. When I was a student on the medicine clerkship, I was found myself struggling to find a path from symptom to diagnosis that I had been taught in my preclinical years because I realized I wasn't exactly sure how to apply the reasoning skills that I've been taught. And I ended up still learning a lot, but it felt somewhat accidental rather than intentional. And when I spoke to my classmates and co residents in the future, I found out that I was not alone in this feeling. Around my second year of medicine residency, I had this light bulb moment. I was finding that I was really loved the process of teaching. At the same time, I met Dr. Reza Manesh, and this was a few years before the clinical problem solvers came to be. And he, along with members of the clinical reasoning community, helped me develop a really good understanding of how diagnosis and patient care works. And this transformed how I learned medicine and then how I practiced and taught medicine as well. I realized at that moment that I really wanted to pay forward everything that I had learned to future generations and thought that medical students and their medicine clerkship would be the perfect audience just because of how I had struggled during my clerkship. When I moved to UCSD, the co-clerkship directors there, Doctors Brian Kwan and Dr. Megan Sabaski, really believed in this vision and helped create a space for me to teach and assess diagnostic reasoning for the medical students on the medicine clerkship. Students responded so well to this. They gained tangible skills throughout the course of the clerkship. They showed so much interest in learning how diagnosis works. And even some students reached out with interest in studying the curricula and its impacts on how we can teach medicine and how we can improve the way that we teach it in medical school. It helped me uncover two things: that students were really interested in having longitudinal curricula developed to teach them reasoning throughout medical school. And then two, it helped uncover how we as a medical education community might do better in terms of teaching diagnosis. And since I've now moved to OHSU, I've been really lucky to bring a few core components of this curriculum that I developed at UCSD to OHSU and implement that here. Seeing medical students improve and evolve their skills with diagnosis in real time has really been the most rewarding experience of my career so far. And to think that these wishes that were generated when I was a medical student to become better at this process could be transformed to potentially benefit future generations of students is truly incredible to me. And I can't express how grateful I am to play a small part in that. So I'm really lucky that this work has been picked up in a couple of different ways by a few different audiences. First of all, a couple of medical students showed interest in studying this work. First is DJ Suto, who's currently a fourth year medical student at UCSD. And he studied the impact of OSCE on assessing diagnostic reasoning skills in medical students in the medicine clerkship. He actually presented the findings of this work at Academic Internal Medicine Week 2023 last year in Austin and just submitted a manuscript to help disseminate the findings of this work. Dr. Alexandra Muse, who was a medical student during the time of this study and is now a first year resident at UCSD, was really interested in the knowledge and attitudes around clinical reasoning within medical students first year through fourth year. Her work was actually presented at the Society to Improve Diagnosis in Medicine conference last year in 2023 as well as an oral presentation. Other ways in which this work has been impacting the institution is I was able to bring several core components of this curriculum to OHSU, namely a case conference for teaching diagnosis and exploring the diagnostic reasoning process with students on their medicine clerkship. The interest around the conference has been amazing and actually has now expanded the conference to the sub-internship, where in which we explore not just diagnosis, but the relationship and the interplay between diagnosis and management in line with the sub-internship curriculum that AIM has put forward. I'm hoping also that this curriculum raises awareness and encourages the undergraduate medical education community to help reinvigorate the passion for teaching students to pursue excellence within the core of being a doctor, and that's becoming an outstanding clinician. First and foremost, medical students everywhere are who I'd like to thank. Students are the inspiration behind all of this work. And without you, this work would not exist at all. So thank you for continuing to inspire me, and thank you for showing interest in this work and going on this journey with me. Specifically, there's several people I'd love to thank, starting with people at UCSD, where this work was generated. Dr. Brian Kwan and Dr. Megan Sabaski are the co-clerkship directors at UCSD for the medicine clerkship. They created this space for this work to occur, and I can't thank them enough for allowing me to pursue this interest. Rob McCauley, who's the director of the Simulation Center at UCSD, helped create the space for the OSCE and allow that to happen. Dr. Stacy Sherratt was also instrumental in the development and the execution of the OSCE as well. I mentioned DJ Suto and Alexandra Muse, who are the medical students who showed such great interest and did amazing scholarship work. I can't thank you enough for your interest in continuing to inspire me. Here at OHSU, where I'm currently at, Dr. Amy Kwan, who is the clerkship director here, Dr. Rebecca Harrison, who's a sub-internship director, my section chief, Dr. Shona Hunsaker, Dr. Emily Janetos, and Dr. Seema Desai of the residency program here, who help to inspire me and motivate me to continue pursuing this work. Lastly, Dr. Reza Manesh and so many members of the clinical reasoning community who have inspired me to be the best that I can as a clinician, as a teacher, and to continue to inspire future generations of students to be the best clinicians they can be.